Welcome to Distrust and Disparities, Dismantling Black Health Disparities podcast. We examine health disparities that disproportionately affect Black women and Black families. In addition, we amplify organizations and individuals working to dismantle racist health practices and systems to improve health outcomes for marginalized communities. I'm your host, Jasmine Moore, a registered nurse, and I'm joined by my good friend and co-host, Camille White. We look at resources as limited and, people try to hoard them versus like say it's a pizza pie and it's like people are like, oh, it's just 8 slices. But instead of people are like, oh, well, I got to take as much for myself. Why not we bake more pies? How about we make more opportunities so that everybody can eat? Everybody can, sustain themselves.
In this episode, we discuss affirmative action and how its overturning has negatively impacted healthcare. And we highlight Dr. Uche Blackstock in her memoir, Legacy, A Black Physician Reckons with Racism in Medicine.
Welcome back to another episode of Distrust and Disparities. I hope you enjoyed last week's episode because that was really fun. It was our first interview of the year, and this is a very special episode. This is our 60th episode. Can you believe it?
No.
Right? This was just once an idea, and now we are 60 episodes in. Like, I can't believe it.
No. It feels like we blinked our eyes and then all of a sudden it's just like, oh, it's like we're in the 50s. And then it's like, oh, we're going to hit 60. It's exciting and also sort of like, it doesn't even feel like we've recorded 60 episodes, like put out 60 episodes. It doesn't feel like it, but it's like also so exciting then though that like we've reached this huge milestone. And I'm really proud of like the episodes that we've put out and we've created together.
Yes. I feel like we've covered so many topics, and just a broad range of subjects. And on my spreadsheet where I like dump like topics and ideas and like articles, at one point I'm like, we're going to run out of stuff to talk about, but no, we are not at all. And this is a niche. We're talking about racism in medicine. I'm like, maybe we'll run out, but no, there's still stuff. There's a lot of old stuff. There's new stuff that is constantly evolving. Like if we had the manpower and the back end, like we could talk about this, 7 days a week, but because we have other jobs and things outside of this, we are just limited to, 2 episodes a month. But it's crazy to think that there is still things going on and plenty of organizations that we haven't heard of that we want to learn about what they're doing, people who are doing amazing work that we can't wait to talk about and to tap in. But 60 episodes in. Pat yourself on the back. Or do a little dance, A
little dance, yeah.
Right. I'm happy. And like you said, I'm proud of the content that we are putting out. But with that being said, we also need to practice what we preach, which is rest. So we are taking a summer break for ourselves. We're not going to release any new episodes for the months of July and August, and we'll come back fresh in September with new content. But we are taking a summer break for ourselves. It's time to rest and time to recharge. It gives us time to kind of absorb everything that's going around us and gives us time to reflect and just see where we want to go next, just with the direction, gives us time to, focus on things that we want to do for fun. And we were just talking off camera. We're thinking about like woodwork. I just started doing like a sewing class. So getting into like my sewing and reading books. We want to read books.
Yes.
So we are excited, and it also gives you guys time to catch up on any episodes, re-listen to any episodes that you haven't listened to already. Also recommend them to a friend. And also, email us your ideas and any topics that you want us to cover. Anyone you would like us to interview, please reach out to us, and we will check that and get back to you. So let's dive into this week's episode. By the time this comes out, Juneteenth would be celebrated, and I always want to make it a point of reminding people, what are we really celebrating? And Juneteenth is a time to really check in and remind people about the history and the continuing experience of racism and oppression that has unfortunately defined much of the African American experience. And according to historian Mitch Catcham, celebrations of the end of slavery should have 3 goals: to celebrate, to educate, and to agitate. So I hope you guys had fun. You enjoyed your time off. If you were off from work, celebrate it. And if you're listening to this podcast, you can also, this is a time you can educate yourself and, think about things that you can do to agitate. I don't know where I'll go with that, but...
So Jasmine included this image from social media that really gives a better picture, I think, for a lot of us in terms of truly how long the U.S. has existed as a country, and also the significant portion of time that, Black people were enslaved. And a lot of people always want to they have this mindset of like, oh, it happened so long ago. Why are y'all bringing up the past? Or then it goes into play. It makes me think about how a lot of photos from the civil rights movement in the 60s were in black and white all the time. Yes. And it's just like, we had colored photos for a very long time. And it's a way to make it seem like that was forever so long ago. And it's just like, we all have family. Like they were alive during that. It wasn't that long ago. And this country still, the post enslavement is still not even the amount of time equal to how long we were actually enslaved, our ancestors. So we haven't even gotten to the exact amount of time. And it just goes to show that like, it wasn't that long ago. And our ancestors lived in enslavement, were, forced into labor for far longer than we've been outside of that sort of period of time. And then all the things that came after, like segregation and Jim Crow. And we're still fighting back now against stuff. So People need to stop always thinking that like, oh, that was just so long ago. It's like, okay, it was a hot second ago, and it lasted a long time, and we're still feeling the repercussions of that to this day. And we have people in power who want to ignore that because they don't want to, be uncomfortable and acknowledge that like their family wealth came from ugliness and evilness, and that you need to really reckon with that if you are trying to be a good moral person that wants to acknowledge the true and real history of this country and actually move towards lasting change and not just performative nonsense that you're like, oh, it's Juneteenth, y'all. Like the White House celebration that occurred. And we done all seen the pictures, I would assume by now, of, the coons on the lawn acting a fool. Shucking and jiving. So,
girl, I try to block that out my memory. Or you remember when they were wearing like
the kente cloth
and kneeling? Oh my gosh, it's like I don't want this performative BS. Like I don't want your Juneteenth ice cream, your Juneteenth cake. I don't want it. What I want is, real action. Like, why even make this a holiday if we're not going to truly reckon with its history and what it means? Like, there's not, American history and then Black history. No, it's all one, and it's of violence. And like you said, we're continuing to repeat the same thing over and over. Like, I would much prefer the government solidify and protect laws that actually matter instead of like making performative, commercialized holidays to take our money and things like that. And it's so many things going on right now that we just seem like we're living in unprecedented times. But last year, on June 29th, 2023, this was like 10 days after we were celebrating Juneteenth, affirmative action was overturned by the Supreme Court. And it's crazy to think, Juneteenth was just declared a federal holiday in 2021. And then, what is this? 2 years later, we're rolling back affirmative action.
I would say yes, declaring it a federal holiday can be seen as sort of like a big deal, but like it's just in sort of words alone. There's not really meaningful action behind that. And so we literally are given like this little breadcrumb of like, here you go, Black people. And now it's like, but wait a second. Actually, we're going to take something away that, truly was very helpful for not only Black communities, but other marginalized communities, and really try to mess up the progress. It's so frustrating because we're given crumbs and then they come and like just snatch a chair from out under us. That's right. What it feels like.
Exactly. It's frustrating. I feel like they want us to be demoralized, but you know what? It's just like we've lived through so much. We've gone through so much. We're going to be fine on the other side of it. Like, it just really solidifies, that this country was not built for us, was not designed for us. And, this is the constant cycle of white backlash. Like, give something, take something away. Give something, take something away. It's just like, okay. Okay.
Okay. Right. We see you. Okay.
Surprise.
Different year, different decade, same BS.
Exactly. And when planning this episode, I wanted to, talk about what affirmative action is, because the term is just loosely thrown around. And I don't think people fully understand what the term means, despite it being, highly controversial. Just like people are taking like words like woke, DIE, what's the other word? CRT. Like, these words are just being thrown around and people are not fully looking into what they mean. And it's just stupid. Or I should say frustrating. Like, come on. Just...
No, but it is stupid because it's willful ignorance where they're choosing to go with some distorted definition for it instead of recognizing truly what it is. And then they want to turn around and, make up something called reverse racism, where it's like, these programs are leading to divisive ideologies. And it's like, no, what you want to happen is you want Black people to shuck and jive and go, oh, okay, we'll just pretend that not everything was terrible. And, slavery wasn't that bad and Jim Crow wasn't that bad. And you know what, white people, y'all are doing like the bare minimum, but that's enough because we don't want to make you feel uncomfortable. Your lives literally aren't in danger because of the color of your skin. But yes, you feeling uncomfortable, those ridiculous feelings that you have that you need to sit with. No. Heaven forbid you feel uncomfortable when literally people existing can result in their death. And that's what it really is. And it is willful ignorance. It is stupid. And it is very frustrating. So yeah, it's important that we like define it. So, and it needs to continue to exist, that definition, and unaltered in its true form, because, if we would allow people to have their way, years from now, people really wouldn't know what it was and they would have this distorted view of it and think it was terrible, because that's what they do. They try to change the narrative and then they end up changing history books. And then years, decades, generations down the line, we don't really know what actually went on. And we end up in situations that our ancestors fought against and, had made progress, but then it was snatched from us.
Exactly. And the whole like reverse racism thing. It's like when we demand equality and equity, people are just like, but that means less for me. Like, you're so used to living in your privilege that when somebody's like, no, you have to share, or, you know, we have to like even this out, you feel oppressed. And it's like before it even happens, just talking about it, people are just like, no, or that's going to burden me, or this is going to affect me. But it's just like people have been living under these oppressive conditions and trying to make way and make do. And people really don't want to change, even people who are so-called like progressive and things like that. It shows when they're confronted with it, they're like, oh no, you're hurting my feelings, or this and that. It's just like, come on. And, you know, research just shows that people continue to be misinformed about what affirmative action is. And this misinformation, it shapes how people react to it and how they respond to it.
Have you checked out our website? There you can find all of our episodes and show notes. You can even listen directly on the site and catch up on any previous episode you may have missed. You can read our bios and see what we're up to. Also, we made it even easier to contact us. Just fill out the form on our homepage and click submit. We invite you to recommend guests and topics we should feature. So what are you waiting for? Go check us out at distrustanddisparities.com. So what exactly is affirmative action? There is a scholarly article titled Understanding Affirmative Action that clearly defines it. And it states that affirmative action occurs whenever an organization devotes resources, and that includes time and money, to making sure that people are not discriminated against on the basis of their gender or their ethnic group. So affirmative action has the same exact goal as equal opportunity, but it differs from equal opportunity in that it's proactive. Equal opportunity is a passive policy that seeks to ensure that discrimination will not be tolerated once it is detected. While in contrast, affirmative action, organizations use established practices not only to subvert, but also to avert discrimination. And in response to the civil rights movement, President JFK created a committee on equal employment opportunity in 1961 and issued the executive order 10925, which used the term affirmative action to refer to measures designed to achieve non-discrimination. And then in 1965, President Lyndon B. Johnson issued Executive Order 11246, requiring federal contractors to take affirmative action to ensure equality in employment opportunity without regard to race, religion, and national origin. And then in 1968, gender was added to the protected categories. So what is its intended purpose, and why do we need affirmative action? I mean, it's because it can help enhance integration and fairness in education and in employment because it operates as a proactive monitoring system. The effectiveness of affirmative action comes from the fact that it is the only means of correcting injustices in the United States that does not rely on the aggrieved parties to come forward on their own behalf. Because if you're relying on victims to advocate for themselves, it's not a good policy. A lot of times, as we've seen through a multitude of things, victims having to advocate for themselves usually results in either they feel attacked, they're re-victimized, or they don't come forward because they know of usually how things will transpire and it won't lead to an actual good resolution for them. And there are many factors that make it highly unlikely that victims will speak up, including fear of retaliation or because they feel pessimistic about winning a lawsuit, which I think plenty of people can think of examples when, someone comes forward about something, especially even publicly, and immediately people want to say, oh, they're searching for their 15 minutes of fame. They're looking for money. And it's just like, this is why victims don't come forward. So even in what people might see as like such a small case of like, oh, someone comes forward because a job discriminated against them, a lot of people I can imagine too and think about are just like, well, why don't you just go find another job? Why don't you? And it's just like, because then it's going to continue to happen and people are going to continue to be harmed by this.
Mm-hmm. And just you recapping the history, it just shows we need to be proactive here in the United States. We need to be very proactive against discrimination.
Yes.
And that is why in, what was it? 1965, we had to make it a federal law because we weren't doing anything. If we just leave it up to people's hands, it shows that it won't get done. And I don't think we're at this point where everybody is colorblind, everybody is considerate, and, we're not at that point. I like this definition because it says, we can't be passive. We have to be proactive. And this article, I didn't include like everything from the article. I just wanted to pull out the main bits. But if you have the time, go to our show notes and read it. But it showed in their research that even when people have good intentions, that they're, trying to do the right thing, they can still overlook certain things. So that's why you need to have systems in place, a set person that is making sure that everything checks out as far as like your hiring practices and just like looking at the makeup of your company and where like you're recruiting people from, having like that designated person that, focuses on those checks and balances can help the organization. And it can also save the company money down the long run so that they are not open to being sued and different things like that they're being proactive and that they're, actively working on these things. And I didn't want to open up this can of worms because, we could have been here all day. But if you look up, there's a lot of research that shows that affirmative action greatly benefited white women because, like I said, they also included gender because not only were, African Americans were being affected, but also white women. They didn't have access to the jobs. Women in general, they thought like if you got pregnant or, things like that, like you couldn't work or that they could fire you based off of, say getting pregnant, getting married, things like that. So affirmative action, really helped women and specifically white women. They benefited a lot. But, there's a lot of misconstrued and myths about affirmative action, especially when it comes to like education. This whole thing like, oh, people are getting like a handout. Oh, you're only here because of like affirmative action. There's like a lot of myths and people really, you need to check where you're getting your information and, because they build upon it and they want you to react based off of a tiny bit of misinformation.
Affirmative action has been challenged several times, I think probably since it was enacted and the executive orders were signed. But we're just going to focus on the case that led to it officially being overturned. So on June 29th, 2023, the U.S. Supreme Court overturned 45 years of legal precedent and ruled that affirmative action in college admissions programs is unlawful in two cases. So it was the Students for Fair Admissions, Inc. versus President and Fellows of Harvard College, and also, it was the same Students for Fair Admissions, Inc. versus the University of North Carolina. So this one organization was bringing, suits against Harvard and UNC. And the conservative majority decision from the U.S. Supreme Court found that race-conscious admissions plans violate the Equal Protection Clause of the 14th Amendment and Title VI of the Civil Rights Act. The court's ruling effectively eliminates the use of affirmative action in college admissions. So in these decisions, white women claimed they were denied higher education admission because of their race. And of course, like we've already talked about, like affirmative action highly benefited them. And there's a lot of research that shows that white women have greatly benefited from affirmative action. So again, this is, I feel like, is like a talking point or something that they were told is what was happening. So that's why they would support doing away with it, when it's just like, in actuality, you're shooting yourself in the foot because you're supporting, you know, this conservative mindset that has brainwashed you into thinking that, like, oh, if you vote along certain ways, like, you'll be benefited. And it's just like, certain white women will benefit, but it's probably not going to be the majority of y'all, unless y'all got connections and money. And I'm talking about a lot of money. Y'all going to also be harmed with this decision.
Mm-hmm. And I just think it's crazy. Like, say you don't get something doesn't go your way, you automatically default to, oh, but the minorities are getting in. They got this advantage. How come they're getting in? Versus, you know, taking a deeper look. Why wasn't I let in? Why wasn't I? What could I have brought to the table? What's going on? But instead, it's like, oh, but they over there, they're getting in. That's not fair, you know?
Yeah, because it makes me think about the whole college admissions, you know, controversy where you had rich people, celebrities, faking, you know, they, instead of spending the money and resources that they had on getting a tutor for their child to get their grades up, to, you know, help them be better test takers. You know, what, I know plenty of people who did after school programs when it came to the SAT. Instead of any of that, they were like, I'll spend thousands and thousands of dollars, if not more than that, hundreds of thousands of dollars, where I'll buy my child's way in, either paying somebody who had the connections and be like, oh, let's fake being on a rowing team. Right. Or, you know, let's buy a wing or build some building, something at this school, and now they're automatically in. They never questioned that. They never questioned the people who were literally buying their way in to a school that those children didn't have any right being there, in terms of, you know, if we're looking at the academic side, they weren't joining a sports team or anything. They were truly buying their way in. Never questioned that, never really batted an eye to look at that, because that's not what was affected with this college admissions thing. The real issue, where there's so many people that are there solely because their grandpappy went there, or their grandpappy or somebody had money to buy their way in. They're looking at the other people who were, you know, forced to go elsewhere, and a lot of times go elsewhere where there were limited resources, or were never allowed in the first place, where they're given a handful of slots to be allowed in, and then they're like, no, get rid of them, because y'all are really just wanting to go back to it being a majority white campus, and you don't want to see people who you feel like don't deserve to be there, when it's just like, they've worked the hardest. They've had to, you know, jump through so many hoops, apply to so many scholarships, try to, you know, have the best and most perfect, you know, high school resume to get in. But like you said, attacking minority groups. Instead of looking, it's like, no, you need to look at the white rich people. How did they get in?
Right. Like you said, did your grandpappy build the stadium, donate to this, you know, greasing people hands? Like, y'all don't see a problem with that, but it's like, no, it's gotta be the Black kids coming in here on affirmative action. And there's also studies that show when people of color, they go into these institutions, that they face all these microaggressions and all this other stuff. People assuming that they're there because of like affirmative action, like they didn't have to work as hard and things like that. And there's has been like challenges that you can't just, you know, admit people just based off their race. They have to meet certain qualifications and things like that. But like you said, nobody bats an eye at, you know, people who are there for playing sports, you know, people who are there because of like legacies and things like that. There's so many advantages that, you know, white people use to get ahead. And also just like looking at social economically, if you have those resources to pay for tutoring and extracurriculars and all those things, and, you know, and you still like, you know, I didn't get in. So you also have the resources to then sue and
yes,
take it up. You know, it's just like, are you serious?
We want to include some of the opinions that some of the justices wrote in their overturning of affirmative action. So Justice Clarence Thomas, who I'm sure most of y'all are aware of, the nation's second Black justice, who apparently had long called for an end to affirmative action. Really interesting, Clarence wrote that the decision, quote, sees the university's admissions policies for what they are: rudderless, race-based preferences designed to ensure a particular racial mix in their entering class. And it's like, yes, it's to ensure that not all white people are in the entering class, Clarence. Like, I'm sure probably when you were in school, Clarence. But as, you know, Jasmine put on the outline, all skin folk ain't kinfolk. And we didn't know that about Clarence for a very long time.
Mm-hmm. Ain't. Like, you want your legacy to be you were going against affirmative action. Like, you just wanted to take it down. Like, you know, you got to where you were instead of like helping other people, you know, reach new heights and things. You like, let's, you know, cut the ladder down. Let's end it. Like, you know, I don't know where you at that everything is just, you know, colorblind and nothing. Like,
he just in the sunken place.
I was going to say be so for real, but yes, that
too. Or also, like you said, he a hot city boy, getting yacht
right
trips and
getting his pockets greased up,
and then he taking care of like what his kids, his grandkids. So Clarence sold his soul a long time ago to be where the white people are and to be taking care of the white people, and, you know, was like, what y'all need me to do? Get rid of affirmative action? Bet I got you. That's what Clarence did. Now, Justice Sonia Sotomayor, in her dissent, noted that the decision, quote, rolls back decades of precedent and monumentous progress. It holds that race can no longer be used in a limited way in college admissions to achieve such critical benefits, and that the court cements a superficial rule of colorblindness as a constitutional principle in an endemically segregated society. She also wrote that increasing the number of students from underrepresented backgrounds who join the ranks of medical professionals improves healthcare access and health outcomes in medically underserved communities. Because we'll also talk about it later on, I think, as well, that when people from underrepresented communities and backgrounds end up in, say, medical professions, they a lot of times go back to their roots. They go back to their communities because they know they're struggling the most. And they go, hey, I was able to reach this career path, get into this field, and now I want to turn around and take these skills and help my community. Where are the white people doing that? Half the time, they usually are like, let's go to Africa and save the poor Black children over there. They're not coming to, you know, the marginalized community, the food desert communities here in this country and going, let's help, you know, our own within the U.S. That's what a lot of other, like, people of color, what they do when they get into these positions, which is why something like affirmative action to help people get to those positions is so important.
Yeah, it's just crazy. And we are immediately just seeing like the backlash from the overturning of affirmative action, and it's affecting all sectors, from education, everything. Every day you see more and more lawsuits, like the diversity and equity section is just, these positions are being disappearing. They're getting rid of like all these different things. And like I said, it's just across the board. And the latest one that comes to mind is the lawsuit against the Fearless Fund. And the Fearless Fund was created by Black women to help women of color grow and scale their businesses. And they point out that when it comes to venture capital, less than 2.2% of that capital goes towards just female funded companies, and then less than 1% of venture capital funding goes to Black women, founders who are Black women. And they've created grants to help assist Black women get the funding and also just to be able to sustain their businesses. And people, now that this affirmative action has been, challenged, people are challenging them. They're saying like, oh, they can't just give grants and money to women of color. And, basically they had two unanimous like white women come forward and say they were, hurt or, they were being discriminated against. And when you look at like the lawsuit, they hadn't even like tried to apply for the grant. Didn't even have like say what they needed running like a business. It was just like all just a front just to go after these organizations. And we're seeing more and more of this. It's just frustrating. Like,
the fact that they were able to make up like, oh, I felt, again, their feelings. It's their feelings that we're dealing with. When, okay, the Fearless Fund ain't for you. Move along and find something else.
You could probably find plenty of other things that you could apply for that you could get. And it's just like, this is like a small slither to kind of assist people with their businesses. Or it's just so selfish. It's like, imagine you have like this whole pizza pie and then you are like throwing away the crust. And then people are like, oh, let me go get a crust. And like, no, then you come up and sweep up the crust and you just eat the little crumbs that's left over. And I remember like this analogy from like this course I have taken, like we look at resources as limited and, people try to hoard them versus like say it's a pizza pie and it's like, people are like, oh, it's just 8 slices. But instead of people are like, oh, well, I got to take as much for myself. Why not we bake more pies? How about we make more opportunities so that everybody can eat? Everybody can, sustain themselves. It's just very, frustrating. It's like, the rich are, have the whole pizza to themselves and they're like throwing crumbs for us to fight over it. And it's just frustrating because if you look at your history, all this stuff just kind of repeats itself because when they passed affirmative action, this was during what we would call like the Reconstruction period, during like segregation and civil rights. And you think, 45 years later, they're pulling it back and we're having like the same thing. We're having to fight for, our rights in this country, as 4th of July comes up, thinking, what are we celebrating? What are we celebrating? Even with Juneteenth, what exactly are we celebrating? We're celebrating lies and hypocrisy. And we want to take some time just to discuss, how the healthcare industry is impacted and, will be impacted by, affirmative action coming down. So there has been a lot of attacks on diversity and equity initiatives in healthcare. And they have come from both private and public sectors. And we're just going to talk about a few cases and things like that. And check our show notes if you want to like read more and go into further depth. But these are just some of the few at this point when we're recording this episode that have come up. At the state level, medical boards, which license, monitor, and discipline physicians, have been targeted. And a lawsuit against the Medical Board of California aims to halt Law AB 241, which requires 1 hour of training in implicit bias as continuing medical education for physicians. And studies have shown that healthcare providers often have negative biases towards Black patients, as well as other racially and ethnically minoritized patients, and that these biases have correlated with poor communication and lower quality of care, while likely contributing to existing healthcare inequities.
And I also want to point out 1 hour. 1 hour of training was required. And I'm assuming if it's for, continuing medical education, that's like 1 hour a year. Y'all telling me y'all really can't do 1 hour of implicit bias training for a year? Like,
exactly. And I'll say with this lawsuit, like I looked into it, it's a Black doctor that's saying he doesn't think he should be required to take, this 1 hour of training. And of course I feel like they're using him like, see, he doesn't want to do it or this and that. But like you said, it's just 1 hour, and I would say in the hospital, like some of the trainings that we have to do, you're just reading, you're clicking through, maybe you have to do the implicit bias test or things like that. But like you said, just 1 hour of addressing these things just so that you are aware. And it's like they want to take these things away, and I'm just like at a loss for words. Like, really, I think there needs to be something more. Like you said, There needs to be training in schools. There needs to be something better than just, the current implicit bias information in the way that we run courses, but just to strip it away. Like, you're just complaining of, 1 hour. And I guess, things that come under, I'm just thinking, so y'all don't want to, be reminded that you got to wash your hands, that you shouldn't harass employees, should we not review fire safety? Like, why can't you just do all these things? It's just like, be so for real. Like, oh my gosh. And then lawsuits against the Tennessee and Louisiana medical boards are challenging the legality of policies ensuring representation of people from minority groups. And such requirements from board memberships can help to ensure that their policymaking considers marginalized communities, their perspectives, and also just reduce barriers to licensures from health professionals from these communities. So they don't even want boards to, make sure that they have like a diverse representation. And then on the federal level, attorney generals from Alabama, Arkansas, Kentucky, Louisiana, Missouri, and Montana, led by the state of Mississippi, have waged a lawsuit against the U.S. Department of Health and Human Services, seeking to eliminate anti-racism plans as an eligible improvement activity for the Centers of Medicare and Medicaid Services merit-based incentive payment system for healthcare providers. And I point out, like, these states have some of the worst health outcomes for, people in general. And then it's dismal for their populations of color. And these are also some of the states that don't want to take federal money to expand Medicaid so that more of their citizens can qualify for health care. And, really. And most recently, North Carolina Representative Greg Murphy introduced a bill that would strip federal funding from medical schools with diversity, equity, and initiative programs. And
because as soon as you start, like, I remember reading this, as soon as you start at Alabama, and I'm just like, we talking about states with statistics in the gutter, with outcomes in the actual gutter. And then they have the nerve to be like, let's get rid of this. Let's attack this and let's go at the federal level to make it where we don't have to. And it's like, so, because you want more of your citizens to like die. You want them to be harmed. Like, this isn't some like, oh, you know, trivial thing where, oh, okay, we won't be as diverse, but like people, like everything will stay the same and people will get the same healthcare. Granted, the healthcare in general, and especially in those places, is terrible. That health outcomes are so terrible. But then on top of that, like you said, for people of color, they're even worse. And you're just like, let's just make it all terrible. Like, let's just make it worse than it. And I'm sure they've had slight improvement because of the affirmative action, because you have people entering into programs to be able to benefit their communities. But now you're like, no, let's get rid of that. Because what you want an all white doctor workforce in those states who then will go on to a medical institution and learn that Black people don't feel pain. Is that what we gonna do? Is that what we trying to go back to? Because that's what it feels like. That's exactly what it feels like. Because if we're looking at what we talked about in other episodes, where there are people in medical schools right now who are still being taught that nonsense, that Black people feel pain differently, or that we all automatically have a higher pain tolerance. I'm sorry, what? It's just an outright lie that comes from slavery. It comes from the reasoning that people were like, oh, we can inflict pain on these, you know, basically subhumans because they don't feel pain or they don't feel it the same way that white people do. And you're just continuing to educate people in that way. And people are really thinking that. And I also then have to question, you're able to become a doctor and you're supposed to be saving lives, but you're not questioning nonsense that, you know, different races feel pain differently. No. Pain tolerance is so subjective and it varies across each individual that exists on this earth. I don't know why you would blanketly think that like, oh, one race feels, yeah. So that's what they're trying to go back to. And like those states, they're just doing what they've been doing for a very long time. But unfortunately, they've been building toward this. And they're, you know, we'll have to see what happens when it comes to these lawsuits.
And just think about it. They're using your tax money to sue people for having diversity in diversity programs and various things. Your tax money is being used for this. Your tax money could be used to have better health insurance and access. It could be used to maybe fight some of these larger corporations of why they are price gouging for food and different services. Like it could be used so that your child has like a pre-K. So they have after school programs, extracurricular activities, that libraries are open. You know, people have safe spaces to go. Your tax money could be used for that. But instead, this is what they're using, you know, state and federal tax funds to sue over, you know, making sure that things are diverse and inclusive. Think about it like that. That's where your tax money is going. And this is what they're doing in the private sector. So a lawsuit against a medical service company offering financial incentives to Black physicians to join was dismissed after the company said they would end the program. And basically, they're trying to recruit Black physicians by giving them, like, say, bonuses and certain things. But this particular company, they attacked them and like, no, y'all can't do this. And then another court case targeted a health services research journal offering a health equity fellowship to specific minority groups underrepresented in the medical field. And the journal removed that requirement, and then the case was dismissed. And we want to point out that all of these cases were brought up by the group called Do No Harm, which purports that it wants to help protect patients and physicians from discriminatory and divisive ideologies. And they're going against basically DIE. initiatives and also efforts for transgender affirming care. This is like their battle. And this group, they're led by the same people that led the overturning of affirmative action. So they're just grouping together and they're doing all these lawsuits and going to court, fighting all these battles. It's, financially draining. And like you said, a lot of times people who are, talking about health disparities, working to correct this stuff, they already have like limited funds and things like that. So they're specifically targeting certain organizations and groups and just going against the little crumbs that they are trying to help, say Black medical students. Like Black students have to take out so much student loans and debt. And then when they go back into their communities, a lot of times they're working in underserved communities where they may not be paid the most. And it's just crazy. And all this is kind of built on this like reverse racism ideology, or the ideology that we're at a point where we're colorblind, that we don't need to see race. But we're going to get into some of the statistics and it's going to show exactly why we need it.
If you are enjoying this episode, you should consider buying us a coffee. Yes, a coffee. That small gesture will help us continue to create quality episodes and content. Click the Buy Me a Coffee link in the show notes or check out our website at distrustanddisparities.com. So why do we need diversity in healthcare? It's because of the existing and widening racialized health inequities in our country. And it's crucial that we have a diverse healthcare workforce. Because if you look at the statistics, Black, Latinx, and Indigenous physicians currently account for 5%, 5.8%, and 0.3% of physicians respectively, despite, though, accounting for 13.6% that's Black, 19.1% Latinx, and 1.3% Indigenous of the general population. So if you look at those statistics and those numbers comparatively, there needs to be percentage-wise, there needs to be more in each category of race, more representation to account for truly the general population that exists. So people can be going to, doctors that look like them, that come from their communities, that understand, their perspective and aren't going to walk into a situation with, biases and stereotypes and outright racism and cause someone to not even want to get medical treatment. And the number of Indigenous people and Black men enrolling in medical school has declined over the past 40 years. Mm-hmm. And research shows that when the provider and patient share the same race, it is associated with numerous positive health outcomes for Black patients, including being more likely to follow healthcare provider guidance and to report receiving preventative care and needed care. And it's even been noted that there's been a reduction in infant mortality. So in counties where there are more Black physicians, Black people live longer. Who would have thunk? More Black doctors, Black people live longer. And I'm sure that goes for across the board for a lot of ethnicities. Mm-hmm. And physicians of color are significantly more likely to work in minority and poor communities. So Black, Latinx, and Asian American physicians are more likely to provide healthcare in communities most impacted by health inequities. So again, if you remove such a huge program that would have allowed and helped them get to being doctors, now those health inequities that still exist and are still very significant, they're only going to get worse. They're not going to be improved. So the Supreme Court's decision to end affirmative action in higher education and the mounting exodus of physicians from the field, anti-DEI efforts may disproportionately drive out racially and ethnically minority physicians from the workforce, which will likely have literal life and death consequences for minority communities.
Yeah, it's crazy. And I just want to wrap up just with this quote from this article because it just perfectly summarizes things. And it says, in the past, medical schools and medical professional organizations have been on the wrong side of progress, impeding Black and other minoritized people's advancement in the field of medicine. Today, these institutions and organizations have a tremendous opportunity to be on the right side of history by honoring and building upon their commitments to justice, equity, diversity, inclusion, belonging, and anti-racism, which they announced in response to the events of 2020 as they acknowledge their own racist legacy. Change at any level demands that we ride the waves of resistance, knowing that with any semblance of progress comes backlash. As such, we call on those within and aligned with the medical profession to embody in language and practice our profession's core values of benefits and non-maleficence and justice. Now is not the time for healthcare institutions and professional organizations to retreat, but instead to be ready and prepared to rebuff anti-DEI attacks by deepening their commitment to and investment in embodying the values of diversity, equity, inclusion, and anti-racism within their organization. Like, it just says, like, now is the time to basically stand on business. Like when y'all was saying racism is a public health a public health crisis, and we acknowledge our racist past, and we're here to make sure that we don't repeat the same thing. So now is the time to stand on that, because yes, they struck down affirmative action, but there is still a way to continue to make sure that your schools, your institutions, you are still looking for Black, Indigenous, Latinx folks, making sure that it is diverse and that it reflects. So you're just going to have to take that extra step and that extra mile, and it can be done. And I know we've been talking for a while, so we're going to segue into our second segment where we discuss, individuals or organizations working to stand on business and dismantle racist practice. And this week, we want to highlight Dr. Uche Blackstock. And we also want to invite you to join us in reading her book, Legacy: A Black Physician Reckons with Racism in Medicine. Like we said in the beginning, we're taking a little bit of a summer break, but we are going to be doing some reading. And one of the books that we will be checking out is Dr. Blackstock's memoir, where she talks about her confrontation with racism in the medical field. And Dr. Uche is a Black female emergency physician and a former associate professor of emergency medicine and former faculty director for recruitment, retention, and inclusion at NYU School of Medicine. She received her undergraduate and medical degrees from Harvard University, making her and her twin sister, Oni, the first Black mother-daughter legacies at Harvard. And additionally, she's kind of segued, from, the clinical setting. She's the founder and CEO of Advancing Health Equity, which has a primary mission to engage with healthcare and related organizations around bias and racism in healthcare, with the goal of mobilizing for health equity and eradicating racialized health inequities. And she has been very vocal about how the strike down of affirmative action will affect doctors of color. And she writes, this is a quote from her, "This is about life and death for us. Today, we are only 5% 5% of physicians. This decision will hasten the deaths of Black people in this country, and we already die prematurely. She also says, fewer Black health professionals means less culturally responsive and equitable care for Black patients. Also, the lack of Black representation among Black health professionals is a problem for younger generations, since you can't be what you can't see. And she's out here talking about racism and medicine. I actually went to a book signing for her book, and this was in Harlem at a Black-owned bookstore, Sisters of Uptown, just where she discussed her book and, just some of the things that she had to go through. And at this event, she was also talking about organizations that are doing amazing work to combat just the undoing of certain precedents. And that's where I was introduced to Emily and of Ashe Birthing Services that we had on our last episode. So she's really, not only talking about what she is doing in her book, but she's also elevating other organizations so that everyone has the chance to grow, that we can truly make a difference. And like I said, we invite you to join us in reading this book over the summer, because when we come back, we're going to discuss some of the points from the book. And I'll just read just what the book is about. It says, Legacy is a journey through the critical intersection of racism and healthcare. At once a searing indictment of our healthcare system, a generational family memoir, and a call to action. Legacy is Dr. Blackstock's odyssey from child to medical student to practicing physician, to finally seizing her power as a health equity advocate against the backdrop of the pandemic and the Black Lives Matter movement. So I'm excited to dive into this book and just see how she also transitioned her, career to opening up an agency that really helps to tackle and call out racism, because we need to learn these things and we need to duplicate these things. So I'm looking forward to reading the book and also just learning more about her and her, path to becoming a medical doctor and, what she has planned.
Thanks for listening to this week's episode. Do you have recommendations for topics we should discuss about health disparities or injustices? Guests we should interview doing amazing health justice work? Or organizations we should highlight creating positive change for marginalized communities? Please visit us at distrustanddisparities.com or email us at distrustanddisparities@gmail.com. Remember to subscribe, rate, and review us wherever you listen to podcasts. And follow us on Instagram, Facebook, Twitter, YouTube, and LinkedIn.